Here's an overview of the Pulmonary Critical Care Fellowship. The concept is that hopefully we are putting you in position to have a very broad exposure and a very good overview of pulmonary and critical care medicine, so you could choose what you want to go into. So we have 6 fellows. The first 2 listed here are the first years, then the second years, and the third years. And just to give you an idea of how the services work, you could see, let's just take an example of Geraldine Secaria. Her first year, she starts out with pulmonary consults for a month and ultrasound for 2 weeks. She does an ultrasound rotation in the emergency room with the board certified ultrasound fellowship ER program. So she's learning the cutting edge technology and how to use the ultrasound so she could teach us how to use it better. And then she goes into interventional pulmonary rotation with great interventionalists who are learning. So she learns how to do a navigational bronchoscopy and e-buses on their own. Already in the first year, you start to learn that. And then the MICU rotation, again, more pulmonary consults than anesthesia rotation. So my fellows will learn how to intubate with training with anesthesia. And again, taking what they learn and teaching even the attendings their techniques using laryngoscopy and video laryngoscopy, of course. Jackson Clinic, so they get to go to a university setting and see that basically they treat patients very similar to how we do, but this is an opportunity for them to learn different specific clinics like sarcoid clinic, ILD clinic. Our patients are more of a potpourri type of situation. Then does a rotation in PFTs, has a little bit of research time. As you get more advanced in your years, you have more research time. If you look at the second year schedule, it's a little bit different because we also offer a Cleveland clinic rotation where they have a very good ILD month. They really enjoy that, as well as a lung transplant rotation, which I think is a huge, huge plus that we have an affiliation with the University of Miami. So this is just an overview of the exposure that the fellows have. And the idea is that each of our fellows are going to be trained to the utmost so that they could venture and be either a pulmonologist or a critical care doctor, whichever they so choose. In terms of the didactics, so every week they have to do 4 board review topics on their own. I set up the pulmonary board review from previous ACCP talks. So the week of July 14th, for instance, this week, pulmonary, they should be doing over community-acquired pneumonia, cystic fibrosis, and then from an ICU perspective, acid-base and acid-base rapid tutorial that is in their folder. And then that Thursday from 12 to 1, I meet up with them and I pick one of those 4 topics. They're supposed to do the test that I sent them on Kahoot on those 4 topics, so they review them. I could check that they've done them, but we do together acid-base rapid so that we talk about it and make sure that they really are studying. And of course, I go over their test scores and make sure that they're really reading. That's the concept, that they're constantly reading, and it's both pulmonary and ICU topics. We should go over every single topic at least twice per year. In addition to that, we have topics. Every Wednesday from 12 to 1, they have a talk either on cardiopulmonary exercise testing or pulmonary hypertension, sleep, pulmonary rehab, PFTs. They have simulations and thoracentesis simulations and lines. Every Wednesday between 12 to 1 is dedicated didactic time for a specific lecture. And then on Fridays, as you could see, what we have an alternating schedule where they do a clinical case conference or a seat question that the fellows will present, or a journal club once a month, or actually once every 3 weeks, and it alternates from fellow to fellow. And this is an opportunity for them to practice delivering a topic and expressing themselves and getting experience in how to present. And then we also go over teaching topics, and attendings are encouraged to attend and teach the fellows this way as well. So again, to review, they have a very broad experience doing pulmonary consults, ultrasound, anesthesia, MICU, SICU, lung transplant, you name it, they should have it. And then from a didactic point of view, lectures on Wednesday, Lectures on Thursday, specifically, it's an interactive board review session, usually with Kahoot. And then Friday, some sort of case conference or journal club, followed by didactics also, and then simulation labs, thoracentesis, ultrasound, difficult airway, and then code blue simulations. And that's basically it.